ve açılış konuşmacısı, Dünya Sağlık Örgütü İnsan Kaynakları Koordinatörü, Sayın Doktor Jim Campbell'ın konuşmasını yönetmek üzere doğayan sağlık yöneticisi, halk sağlığı hekimi, Üsküdar Üniversitesi Tıp Fakültesi Dekanı, Sağlık Yönetimi Bölüm Başkanı, Sayın Profesör Doktor Haydar Sur hocamı sahneye davet ediyorum. Sahne sizin hocam.
Hello, good morning.
This is Dr. Haydar Sur from Üsküdar University, and today I am the guest chairman of the session, and we all say hello to you from Karadeniz Technical University. Our rector and top-level managers and professors are ready to hear you, as well as our students and colleagues from the industry, health services industry. So we are very glad from your participation. All the audience, I asked and they said all know English, so we don't have any translation trouble. The floor is yours. Thank you for your participation.
Thank you very much, Professor Dr. Haydar Sur, and good morning to all the faculty, students, colleagues participating for today's presentation. My name is Jim Campbell. I'm the director of the Health Workforce team at the World Health Organization. It's a pleasure to join you today and give you an overview of some of the contemporary thinking at the World Health Organization on this topic. What I'll do is I'll go through a sort of an overview of the global perspective, some of the work that we've done most recently at the 5th Global Forum on Human Resources for Health, and then bring that into the context of some observations for Turkey. So the key challenge around the world for anybody in public health, in health management, in our health sciences, is how do we deliver health and care services to the populations we serve, given the many challenges that are ongoing around the world. We've seen clearly the impact of a global pandemic, but we've also seen in Europe, in the Mediterranean region, elsewhere, the impact of conflict and war and large-scale population displacement as people migrate either through that disruption within a country or through climate-related disaster, etc. Then we're seeing the impact of the economy around the world as we've seen this aggression in Ukraine, and then the impact upon rising costs, inflation. It becomes more expensive to deliver the same health services with energy prices high, with consumable prices increasing. So all of these issues continuously challenging all of us at any one point. Those challenges also, though, come at a period when the world globally is looking at the Sustainable Development Goals. And at the end of June this year, we will reach the halfway point of this 15-year development agenda. That first half has been dominated by public health emergencies of international concern, whether that's Ebola, Zika, or the continuing challenge with COVID-19. In addition to that, we've got the conflict, increasing conflict, a climate-related humanitarian disaster coming further forward. So as we're positioning ourselves for the World Health Assembly later this month in Geneva, the 76th World Health Assembly, and the 75th birthday of the World Health Organization, what lessons can we learn? And what of those lessons can inform and influence the global thinking in the second half of the SDG period? Some of the global data that we've published with the support of member states sets out that we anticipated in this SDG area. Originally, we're starting with a global workforce shortage in relation to universal health coverage of 18 million workers by around the world. That figure, as impressively, has reduced to 15 million in 2020 with pre-COVID data, and it's projected with the investments that have been taking place in education and employment. It's projected to come down to 10 million by 2030, which is a substantive improvement in the period, even if it's not eradicating this global shortage in comparison to the attainment of universal health coverage. However, that headline number masks inequitable progress around the world. You can see here the Southeast Asia region with the largest shortage originally, with projections coming down to less than 2 million. So the major 75% improvement almost in this next period. But we're not seeing that same investment into education and jobs having an impact across the Africa and Eastern Mediterranean regions. So there's still a global shortage, and it is particularly inequitable in terms of the anticipation, which gives us cause to make sure that we have action against that agenda. COVID-19 has had many impacts around the world, one of which is that it did create additional urgency in strengthening the health workforce in many jurisdictions. Turkey has this lived experience yourselves. But as countries looked to rapidly recruit personnel to their workforce, they included in that the opportunity to recruit from international health personnel who may be looking for career opportunities, maybe looking to move jurisdiction. And as a result, we've seen the rapid acceleration in international recruitment of health personnel, and that's starting to be transferred into reporting and our data. Almost 1/3 increase, more than 1/4, coming towards 1/3 increase in the flow of medical doctors into OECD countries, and it's nearly 80% increase into nursing. Now, obviously, countries that have the ability to recruit and pay salaries and pay wages will continue to do so, but there is a concern that may inadvertently impact countries with less resources. And so the WHO reconvened the expert advisory group to look at the vulnerabilities that are existing in low and middle income countries and whether migration needed to be better managed to avert any challenges to service delivery. And what do we see when we look at the data? In March this year, we published an updated support and safeguards list, which identified 55 countries with particular vulnerabilities around the workforce. These countries have an average life expectancy that's considerably less than in high-income countries. 8 years less than the average, 17 years less than high-income countries and above. For every 700 inhabitants, there is one health worker, whereas in high-income countries, that's one health worker for every 70 inhabitants. So a 10-fold difference between the availability of personnel. And that reflects into the delivery of services, the coverage of universal health care, and some of our major service elements, and does leave populations who are vulnerable behind in the aspiration of health for all. The other challenge from COVID-19, very contemporary issue, and I'm actually calling you today from the World Public Health Congress that's being held in Italy to discuss some of these challenges. The demand now to make sure we have a public health workforce that's competent and capable to respond to all the essential public health functions, including the next outbreak, including emergency preparedness and response. And so we've been working with partners around the world to look at how do we support that national workforce capacity building. So as health service managers, as health policy, as students and faculty, this is particularly a critical issue at the halfway point of the SDGs for our thinking. What we have is with the associations, institutions, and schools of public health around the world, developed a roadmap with 3 core action areas. Firstly, to understand what are the public health functions, your package of services that are being delivered, which institutions and which individuals are responsible for their delivery, and where are those gaps, where are the strengths, where are the weaknesses, what are the opportunities for you to look at that function, the service, the institutions, the role. Secondly, to look then at their competency-based education of the individuals in those institutions. What competencies do they need to perform their practice activities, their tasks, to deliver on those functions and sub-functions? And thirdly, to be able to enumerate that. Any health manager will know, without an understanding and appreciation of who is in your workforce, where are they, means that you are trying to do policy with one hand, if not 2 hands, tied behind your back. All of this context, this global context that I've just described, these contemporary issues, were part of a major event that we held at the start of April in Geneva, the 5th Global Forum on Human Resources for Health. This year, as this occasion was held during World Health Worker Week, which is celebrated around the world the first working week of April, and coincides with World Health Day, the 7th of April. And we held this around the theme of protecting, investing together in terms of the key elements that we've seen. And I'll come back to those topics momentarily, because that language, this protect, invest together, is very much language that Minister Farettin-Koca is also been working with the World Health Organization on back in 2020, 2021, and it continues to be part of the World Health Organization's key narrative as we look further forward. At the Global Forum, we were looking at around the second half of the SDGs and what actions do we need to take to address the projected shortages. And it's always good to ask the question, well, where are the shortages? And at a global level, there's a number, but we need to disaggregate continuously in every jurisdiction, in every setting, to understand the particular unique needs and requirements for that country. And so if you look at those countries with the highest shortage, you get a particular listing. And some of those countries that are heavily populated with continuing population growth coming into that top 10 list. If I look at those countries on the right-hand side, which have the largest relative shortage, so what a growth is required compared to their current workforce, it's a different list, and we tend to see some of the Francophone African countries really coming to the top of that list there. Meanwhile, if you look at the work on the small island developing states, which have got particular challenges a different list. And if you were to translate that into Turkey and its neighbors, if you were to translate that into the WHO European region, you would come up with different countries with different shortages based on different criteria. So it's always good to be looking at this challenge. However, one of the consensus that we had coming out of the 5th Global Forum around these themes and terminology is really, as we go into the second half of the Sustainable Development, learning from all of our shared history, our experience around the world through COVID, that there are certain issues which are fairly universal. Firstly, we have to protect today's workforce around the world. They have been at the forefront of the global responses, national responses to the COVID-19 pandemic, and we have to protect them. And that includes their occupational health and safety. It includes the decent work environment. It includes their pay, their terms and conditions. And in many, many countries around the world, the workforce is predominantly female. And we have to look at those gender inequalities that exist and remove those from the workforce. The protection also, if we want to have decent work, we need to protect our investment into these workers. So ensuring that despite any economic downturn or economic pressures, which we've seen with the global macroeconomic outlook, that we do not penalize the education sector, the health sector, the social services, and that we continue to invest in our human capital as a national priority, as a government responsibility, often as a constitutional responsibility, that we continue to protect that investment into health. We must ensure that if we're educating workers, that we need to then employ them and create those working conditions to them. We've got the paradox around the world that in many economies, we have unemployed health personnel coexisting alongside population needs for health services because of the inability to create the fiscal space, to have the budget to pay wages and create jobs. We need also globally to reconsider our education approach for our human capital, our education approach for the future health and care workforce. And encouragingly, the forum had plenty of examples of the evidence where countries are making substantive progress. We saw in this Southeast Asia region, this increase in potential increase, given all the data we have, is likely to almost reduce the shortage by 70-75% in the next 7.5, 8 years. That's a major success. And we want to learn from that and say, okay, what else can we do around the world? And what we're saying is that it's feasible, both technically and from an economic perspective, to double the workforce to enhance supply and employ all graduates. And we looked at, in those 55 countries that are furthest behind on universal health coverage and health security, the affordability element of that would translate to an investment which is less than 0.5%, 0.3 to 0.5% of GDP would, over this period, that investment in education and human capital would end up doubling the workforce if you secure the jobs at the same time. And in high-income countries, that similar level of growth would ensure that they are meeting their needs from their own domestic resources and would reduce these pull factors on the international recruitment. It would reduce the migration of health personnel, which often creates additional challenges for low and middle income countries. So that education and employment also having the co-benefit of offsetting some of the migration challenges and creating greater alignment with the WHO Global Code of Practice. all of this has to be done together with our different stakeholders. The policy briefs and evidence briefs at the Global Forum for yourselves in Turkey, it is an undertaking which needs the education sector, the employment sector, the jobs and labor colleagues. We need the finance colleagues with us, those who are working in gender, those who are working in rural development. Everybody working together, using the data and evidence in the country, from the country, to tailor that data dialogue decision process to your needs. That's the global context, colleagues. Let me come now to some perspectives on Turkey. And firstly, to the Dean, to the co-chair, Professor Dr. Sedat Bostan, thank you for the opportunity to continue the partnership with Turkey. We saw in 2020, Minister Fahrettin Koca was one of the first ministers to really discuss the demands on the health and care workforce and creating a global awareness, the necessity to recognize their contribution in the early days of the pandemic and go beyond that into action. And that triggered, Turkey requested the WHO to develop the International Year of Health and Care Workers in recognition of the workers around the world. And at the time, the president of the UN General Assembly picked up on this, President Volkan Bozkır, one of your senior Turkish diplomats who was chairing the presidency of the General Assembly, picked up on this, and this created a global groundswell. What we then saw was in 2021 the adoption of the International Year. Minister Koca again working with us to highlight the actions that have been necessary, and Volkan Bozkır with the diplomats in New York resulted in a joint statement of over 121 countries around the world supporting the International Year of Healthcare Workers and calling for action along the lines of the need, here we come again, the need to protect the health and care workforce, the need to invest, the need to finance for them, and the need for action, and carrying forward those messages into the respected international journals around the world. There's health sciences, health management journals that are really saying, here's the evidence, here's the policy, here's the dialogue that we need to create. And let's use data just then to highlight, because there are the diplomacy, that global diplomacy from Turkey has been internationally recognized by your peers, but your national actions are also exemplary in terms of how you are driving improvements over many, many years now to try and ensure that you have the workforce for universal health coverage and global health security. And we're seeing in the data that your colleagues in the Ministry of Health produce and report to the World Health Organization through a process called the National Health Workforce Accounts, that your data is signaling an increase in the number of full-time equivalent personnel, which is translating into a greater density in the workforce coming further forward. And we're seeing this almost 60% increase in your stock in a decade, which is a major substantive progress. We've seen that in, I'm getting a little bit of feedback here. The sound is still covering. We have, if we look then a little bit more beyond the headline numbers, and we start to look at the age and the gender elements, you also seem to be having this production acceleration. You have a relatively young workforce compared to the median in the European region. So again, your investment really paying off. You don't have a demographic retirement challenge, which is about to hit the country, whereas other European countries are looking at a major headache with their workforce to the share approaching almost 40% of their workforce due to retire. So you're in a good position around your age, and you're in a relatively good position around some of your gender dynamics, a little bit behind to medicine. And that may be an opportunity to look at some of your gendered policies around access, student opportunities and employment opportunities in medicine, but otherwise tended to be around things. And then if I look at the right-hand side here on your education investments, and if earlier we said that the consensus to avert the global shortfall is that we need all countries in the range of 8 to 12% in their education and training institutions compared to their stock. And you're very, very close in Turkey, your data, to that range. Slightly, some minor improvements and additional investments in some of the occupations would hit that range, and you're actually doing very well within your dentists. So again, it's not just the diplomatic effort from Turkey, but it's actually your national policy efforts. When we look at your data, now obviously, Dean, you're there in the everyday dealing with those Turkish issues, and I'm sure there are many challenges, many opportunities, many improvements that that you could improve, get engaged on. We appreciate that. But if you step back and look at this global aggregate data and start to look at the Turkish data in that light, in comparison to others, you do also need to recognize that there is cause for some celebration, that you are making major gains, and these are being recognized by your peers around the world. So colleagues, thank you very much and appreciate. I wish you an excellent Congress, an excellent conference on your topics, and thank you very much for the opportunity to join you.
Dr. Campbell, we are very glad and your very beneficial and excellent speech. So you told a lot of things. While we were listening to you, we wrote a lot of lessons for us, for our country, for the humanity. So we are grateful and thankful to you. Is there any question? There is one question from Salon. Let him ask his question. Yes.
Sorry, I can't hear.
Okay.
So you can talk now. It's better.
Okay. And can you hear me, Teresa?
Yes, loud and clear.
May I use it?
So
Okay.
you can talk.
Okay.
And we are listening him
Okay,
from,
okay,
yes,
okay.
from you.
Okay, thank you for your very valuable speech. I learned a lot of. And I'm Professor Chichang Zhang from Taiwan. And I think we all know, as long as they have been nurses, they have been nursing shortage, right? And actually, we are facing Asian population increasing this year. And I think long-term care would be another critical question in the next 2 decades. So my question is how to design an education for nursing education, and especially for digital health competency. Thank you.
So thank you. Obviously, we had also the International Year of Nurses and Midwives, and we published first edition WHO, the state of the world's nursing in 2020, looking at some of these challenges. And WHO member states have a document which is called the Strategic Directions for Nursing and Midwifery, which sets out the policy recommendations, the evidence base and the policy recommendations for that. Dean, I would encourage you, I can send you the links to your team, and please do disseminate them. But it's on the WHO website, presenting the evidence and the policy options. It's a priority, and every country, whether it's an aging population, whether it's an emphasis on primary healthcare, whether it's an emphasis on their public health and health security, needs to determine those resource allocation decisions, whether that's going to be the skill mix, which occupations, and clearly the evidence unequivocally sets out that the nursing occupation, when licensed and able to work to their full scope of practice, is a fantastic return on investment for any health system. So we look forward to, happy to support any discussions on that.
Dear Dr. Campbell, thank you for your very beneficial and special speech. We are thankful to you. Best regards from Turkey, Trabzon. Thank you very much. Applause, please.
Thank you. Teşekkür.
Çok sağlık insan gücünün olduğunu, dünyada bununla ilgili gelişmeleri ve niçin önemli olduğunu özetledikten sonra gelecekte bunun ne büyük sorunlar getirebileceğini ve bugünden önlem alınması gerektiğini. Zaten bugün hemen her sağlık mesleğinde bir shortage, kıtlıktan bahsediyor ama birçok ülkenin de sağlık personelinin yaşının 55 ve üzeri olan oranlarının çok fazla olduğunu, bugünlerden yarınlardaki personelimizi yetiştirmek için bir stok yapmamız gerektiğini altını çiziyor. Bu açıdan Türkiye'nin biraz daha avantajlı bir ülke olduğunu söyledi. Toplam sağlık personeli, hemşire, doktor, diş hekimi, her birinin içinde ayrı ayrı yaşı 55'i aşmış olanların oranları nispeten bizim ülkemizde daha düşük. Avrupa ülkelerine göre. Bunda EYT'nin de rolü var mı bilmiyorum Sedat Hocam. Erken emeklilik. Ama şunu biliyoruz. Hemşirelik gibi çok ağır gece gündüz yükü olan şeylerde yaşı 55'i aşan hemşirelerin emekliye ayrılma isteğinin çok yoğun olduğunun farkındayız. Dolayısıyla gençleri yetiştirmek gibi bir görevimizin olduğunu da bir kenara yazdık. Yarınlardaki yine sağlıklı nesillerimizi yetiştirmek kadar sağlığa halel gelmemesi için onlara sağlıklı sağlık personeli yetiştirmek de bizim görevlerimiz arasındadır. Bunu bize bir kere daha rakamlarla ve akıl sebep-sonuç ilişkileriyle açıkladı. Ben kendi adıma çok yararlandım. Böyle güzel bir konuşmayı organize ettiğiniz için başta Sayın Rektörümüz olmak üzere Trabzon'umuzun tüm ileri gelen yöneticilerine Sedat Hocamızın vasfında teşekkür ederim. Bu seansı bitirmiş olalım. Saygılarımla.